One didn't have to look hard Tuesday morning to see the pain on Portland streets.
Emptiness. Feels like I'm not a person.
On a tent-covered corner in Old Town, a homeless man threatened city camp removal crews, so they called police. When officers got there, a man overdosed on fentanyl.
Before the authorities and all that kind of came on, there was all just hands in their pockets, like, oh, there goes another one.
He was Bobby's friend.
He lost his family a couple years ago, and it was the anniversary of that, so I think he just wanted to go see his family.
Across the river, inside the Multnomah County boardroom,
when presenting, make sure to unmute your mic.
Tensions rose as commissioners were updated on Portland's 90-day fentanyl state of emergency, declared late January.
I think many of us are just frustrated with our system or lack thereof.
The update included new details on a pilot project that pairs police with outreach workers in an effort to connect homeless people struggling with addiction to services.
My addiction's so bad, I'm a polysubstance user. I've been an addict since I was 11 years old.
And I know Multnomah County truly appreciates the opportunity to support this pilot and continue making this difference in our streets.
Data shows since mid-December to late February, police and outreach workers interacted with 99 people on the streets. 52 expressed an interest in services. 37 were connected to those services, and 14 got into same-day detox. The data goes on to show, of those who wanted services, 47%, nearly half, did not get them.
We are woefully under-resourced, so we need to really be investing in expanding capacity right now for treatment resources and healthcare in general.
Joe Bezeghi is with Recovery Works Northwest, part of the team of outreach workers under this pilot.
If we're going to be connecting with people and saying, okay, here is the door, here is where you're going to connect with resources, but the access and the capacity isn't there, then that potentially can do more harm than good.
Getting into treatment and having nowhere to go, if you want somewhere to go after, I think is damaging.
But for people like Bobby, who runs at the sight of police, it's the program itself that can be damaging.
Stop pairing with police. Like, we have some people out here, like I said, with mental health issues, and they see police banner next to someone who wants to help, and it just makes them angry because they want the help, but they can't even articulate the ability to ask for it because they got to worry about going to jail. Like for me, after this, once I leave.
Okay, Blair, so it seems like that man there would want help, but he's saying the police involvement is getting in the way?
Yeah, that's right. And many people are just like him. I mean, he tells us he has warrants out for his arrest, but that he would love housing and treatment. In fact, he said he has a housing voucher that he got last month, but that he can't bring himself to ask for help because he's too afraid of being arrested. When he walked away today, the last thing he said to us was, "Look me up in a week. I bet I'm in jail."
All right. Well, how often are police and outreach workers doing this? I know that last week the program was expanded for another year.
Right, so they're doing it sporadically, a couple times a month. The next time they plan on going out is this Thursday, and their focus is downtown Portland, specifically Old Town. But today, county commissioners pretty much across the board called for this program to be expanded countywide, seeing as the fentanyl crisis is happening beyond just downtown. And here's what one commissioner had to say about it.
I do have concerns. Again, I mean, we've had conversations about how this is really focused on the central core area, and East County cities are feeling pretty neglected. So I hope that maybe we can talk offline and share best practices. I know that I've talked to the joint office, and to make sure that I feel like we have so many silos within the county and with our partners. So I just want to make sure that maybe we can expand this program.
All right, Blair, weren't we supposed to be getting more updates on this state of emergency? They said they wanted to keep this transparent.
Yeah, that's right. And in the vein of transparency here, I do want to add this pilot project. It did not start during the state of emergency. It actually started before the state of emergency. So it wasn't something that came out of this declaration, even though, as you mentioned, it was expanded last week to last for a year. But yes, those updates, we were supposed to be getting them more regularly. I believe they said every 30 days. So far, we've only gotten one formal update. All the other updates have happened during county board meetings, which no one would know about unless you check the meeting agenda. So seeing as the state of emergency is ending in just a couple weeks here, by the end of April, I asked if we're going to get another update formally. They said yes, but that they don't know when.
Oh boy. All right. Well, thanks for staying on, Blair. I appreciate it. Great reporting as always.